May we continue to be fearless in our pursuit of learning and understanding from one another. The decisions we make today will affect 7 generations back and 7 generations forward. Hello, everyone. My name is Deborah Eberhardy, and thank you for taking the time to listen to these reflections that I've discovered during my doctoral studies through Five Branches University. My focus for this presentation is sharing what traditional Chinese medicine can do for liver cancer. As I bring this information externally, it will also represent an internal or personal presence of integration. I'm highly influenced and blessed with being a Native American woman and regard this lineage as being my first form of medicine. In so many ways, the Native American wisdom and the Chinese wisdom share the same depth of beauty and efficacy. As I accept the responsibility of having another feather added to my cap from this doctoral program, I just want to say how honored I feel to have learned so much and to be invited to bring this knowledge externally. I am but a small bead sewn into this beautiful tapestry of original medicine utilized for thousands of years. Accepting my limited omnipotence of this topic, my presentation will briefly cover more about why I chose this topic, brief introductions to what I discovered, what my plan of action continues to be, and I'll finish with a brief statement of my general reflections. Over the years, I've learned that when someone asks you to be their teacher or helper, they also become yours. This is our way of higher education and higher forms of healthcare. I chose to study this topic for both personal and professional reasons. In the field of medicine, it is our lifelong journey to help ourselves, others, and all things to have good health, happiness, and long life. Personally, I chose to focus on how TCM can help liver cancer because I've had way too many relatives who have passed from this disease, and I felt stunted in my abilities to help them when they have requested my guidance. This is not a good feeling, so I decided to transform this helplessness into inspiration. Professionally speaking, I've realized that most liver cancers are already in their late stage when they're diagnosed and treated in the Western biomedical paradigm. However, most liver cancers do have previous chronic liver diseases that are induced by alcoholism, viruses, diabetes, and fatty liver disease. I believe TCM can alter the path of chronic liver disease, which leads to cancer. Elders are considered sacred wisdom keepers. However, they don't hold on to the wisdom because they know it is not theirs to own. Instead, they release it back out to the world to help people and to protect future generations. Because of these wise elders, TCM teachers, and scholars, I've realized there is a great deal of TCM research regarding prevention, treatment, and integrative medicine that can help determine the course and outcome of liver disease. Dr. Yaron Mayamam, who specializes in TCM oncology, has teamed up with Dr. Julie Hartong, MD, to offer an integrative certification in comprehensive oncology acupuncture. In this program, they combine both TCM and Western biomedicine to help us understand, diagnose, treat, and collaborate with the Western biomedical paradigm. It wasn't difficult to find evidence-based information from published TCM practitioners regarding herbal and acupuncture efficacy. I've already begun to establish a strong herbal presence in my pharmacy just for influencing the path of chronic liver diseases. However, as we have learned in our doctorate program, our presence as TCM professionals is populated but invisible. More work does need to be done with communicating this to patients and other medical professionals. When we are young, we are given a vision or glimpse of what is yet to come. Then we let it go and follow the ways of the wind and water to help guide us. When you follow this developmental or business plan, you realize no matter how big the currents or the storms may come, if you're brought to it, you will be brought through it, keeping you directed to your final destination. Currently, I apply what I have learned every day in my current practice. I've changed my intake form to ask questions about medical labs that patients may have received regarding their liver panels. If there are labs or symptoms related to the liver, I treat accordingly with TCM. I have recently been invited to give a presentation at our community YMCA that holds classes and workout sessions for cancer patients, both in treatment and in remission. As I continue to grow and refine my clinical skills, I intend to complete my certification in oncology acupuncture from TCM Academy, research and develop preventative care services such as nutritional plans specific to liver cancer, thermography testing to detect fatty liver, developing a specific intake to analyze medical labs related to liver functions, continue to develop my herbal pharmacy specific to prevention and treatment of chronic liver diseases and cancer, and last but not least, create and administer an outreach program that teaches other professionals about how TCM can help prevent and treat liver cancer. So in general, I'd like to say how grateful I am for my elders, teachers, and fellow students. I've been both humbled and heightened by your wisdom, knowledge, and guidance. Eagles always hang or soar with other eagles. First, strive for internal integration and wholeness in all that you do. Then you can feel good about being the bridge to the external, helping and being with others who are on the same path of integration and wholeness. I look forward to continuing my work in understanding and applying what traditional Chinese medicine can do for liver cancer.